Turning to today's Health Watch, a new study shows a possible link between COVID and type 1 diabetes in children. Even though doctors say in-depth studies are still required to explore the link, right now they want parents to pay attention as more and more children get infected with COVID. Concerns about type 1 diabetes in pediatric COVID patients growing as cases rise. In a recent study by the CDC, they found an increased risk of type 1 diabetes among those who were infected recently.
What they found was there was an association of an increased risk with diabetes in those who had had COVID in the prior 30 days.
The CDC looked at insurance claims from 2 U.S. health plans. One database showed an increase of 166% in new diabetes among kids who had COVID. The other data set showed a lower but yet still concerning spike of 31%. Dr. Brad Cottrell, an infectious disease doctor at UT Southwestern, says while the data doesn't prove a direct link, it is still concerning.
It's certainly possible that people who had other risk factors like obesity or other things like that, maybe they were at higher risk to develop COVID-19 and also were at risk for diabetes. But I think what it does do is it highlights the fact that there may be long-term health effects or consequences of getting a COVID-19 infection. And so people should be aware of that and should continue to take precautions.
The doctor says COVID-19 can cause other systemic problems in the body.
It can cause, neurologic consequences. It can cause cardiac consequences. And there's even some data suggesting that the virus could affect the pancreas and some of the specifically the cells in the pancreas that make insulin.
Symptoms of type 1 diabetes include increased thirst, increased bathroom breaks, hunger, and even blurred vision. Now, another study by the CDC found that 2 doses of the Pfizer vaccine protected hospitalized patients ages 12 to 18 against severe multisystem inflammatory syndrome, also known as MIS-C. It can develop 2 to 6 weeks after infection. Dr. Cottrell says vaccination, masking, and distancing are still the best weapons against the virus.